Healthcare, for example, how much we are spending on primary healthcare in Pakistan? Silence is the answer. I agree. I agree. Because we don't know. Because we don't even look at our health budget, that how much budget is being spent on primary healthcare. Very right answer. And that is the situation in many developing countries. And why we have done this? We have done this because primary healthcare is for poor people. It is for rural areas. These people are voiceless people. Nobody is representing them. They are not creating havoc for you in political echelons of power. And one hospital after another, we are building in urban centers. I'm not against hospitals, don't take me wrong. But you have to put your priorities right. No country in the history of public health has been able to change its public health indicators by spending only on hospitals. Remember this. Never. Countries have achieved better indicators of neonatal, of antenatal care, of maternal mortality, of detecting tuberculosis patients, treating hepatitis by investing in primary health care. And one of the brightest examples is next door, Islamic Republic of Iran. 70% of their healthcare budget is being spent on primary healthcare. Sri Lanka, a little further, has achieved universal health coverage by investing in their primary health care. We are actually investing now in big hospitals primarily because we have not invested over the decades in primary health care. Because everybody with Zakam and Kharish is coming to your tertiary level facilities. They must have been treated at basic health unit level and a working rural health care center. So this is another reflection. When there is an elite capture on the state, primary health care is the first casualty. I hope you understand what I have said. When more resourceful people who are self-serving, who come from elitist backgrounds, who are landlords, when they have to allocate resources, when they are put in positions of power, they create big 5-star hospitals which can serve them and their families. And they do not invest in primary health care. I cannot emphasize enough. And that's why in my first interview with my Prime Minister, I told him this. I said, hospitals, great idea, and you have done wonders. And we needed a great cancer hospital. But, sir, our solution lies in when we start investing in primary health care. And he has started talking about primary health care. Now, what are we doing about it? So we have, actually I started this work when I was still serving in WHO. We picked Pakistan as a first pilot country to develop a national package of essential health services through a very scientific method. And when I say pilot country, we are a first pilot country of DCP3, which is University of Washington, where this work has taken place. And we are at the tail end of developing this national package of essential health services. And this package we are going to launch in Pakistan and implement as Wafaki Hukumat in Islamabad Capital Territory to create and establish and showcase a model healthcare system with focus on primary health care, not ignoring big hospitals, but appropriately managing them, giving them autonomy, and they should be delivering only limited services which require hospital care. And that's where we are investing in. So part of it we have developed for federal areas, and for national purpose we are going to launch it so that our provincial governments can also emulate them according to their preferences and according to their needs. Now, if time had allowed me, I would have gone that what is the process of selection of essential healthcare services, but for that you have to invite me again, and I'm happy to speak with your staff about it. That what is the process, what goes into it, what are the criteria, because these are very different tough choices that you have to make, and there is a methodology behind this madness. So this is what the government is doing on developing an essential package of health services so that everybody can be served according to their priority needs. What about financial coverage? The second pillar that I talked about. So those who cannot pay, and if we know that 60 to 70% of people are going to the private sector, and also knowing well that spending on health by poor make them poorest. We call it catastrophic health spending or impoverishing health spending. The number one cause of poverty in low and low middle income countries is spending on health. So what do we do about it? So in Pakistan, I think we should start taking pride in it now, that we have started providing health insurance to the poor people. So that they don't have to spend from their shallow pockets and by taking loans and by selling their assets. So as we speak, the Sehat Insaf card has been distributed to 6.8 million poorest of the poor families in Pakistan. And our target is to actually distribute it to 14 to 15 million poorest of the poor families. We are talking about 110 million people. And in this, knowing well that vulnerability is not just income poverty. Vulnerability comes in so many different forms and shapes. So we, as an affirmative action of the government, we have also provided health insurance through Sehat Insaf card to all disabled people in Pakistan. To all transgender people in Pakistan. And we have a couple of other vulnerable groups that we are focusing on and we are working on. So this is a state with empathy. This is a state with ihsas, and hence our ihsas program, which is the largest ever program in the times of economic difficulty that our Prime Minister has put his foot down, that come what may, we will find domestic resources to finance this program, 200 billion Pak rupees program, which is aimed at poor, disadvantaged, marginalized, handicapped, disabled, and you name it. And another program of 100 billion rupees, which is aimed at youth. It has its own vulnerabilities. If you are young and poor and uneducated, you are the most vulnerable and frustrated person. And 50% of this 100 billion is going to be spent on young women. And again, I'll spare you with the details. The point is that the second element of universal health coverage, which is financial protection. What is our progress report on it? I just shared it with you. And the third element is quality. So for this, we are starting a program in Pakistan for both public and private sectors, which we are calling patient safety friendly hospitals or patient safety friendly health facilities. A set of indicators, you self-evaluate yourself, then have an independent evaluation, and if you fulfill all the criteria for infection prevention and control, solid hospital waste management, etc., then we declare you as patient safety friendly hospital or patient safety friendly health facility. So these are the three elements of universal health coverage, and this is what we are doing about it. And I'm so glad that I got this opportunity to explain this. You can invite me for a 3-day workshop on this. I will also hold it for you. But the thing is, my dear ladies and gentlemen, that a time comes in the life of nations that you have to transcend your personal interests and work for the society. And public health demands that today in Pakistan, and if we don't do this, we will not be remembered very nicely. This government has determination and commitment like never before in the history of Pakistan, and we will transform healthcare in Pakistan through operationalizing universal health coverage, and I thank you very much for your attention.